If you were tuned in to the chatter around the 2025 LeadingAge Annual Meeting, and, well, it felt like everyone was, you definitely picked up on the main thing, right? This huge challenge facing the senior care sector. How do we actually support the people doing the caring? How do we keep them?
Right. That question is basically the pivot point for, well, everything in the industry now. We're looking at a workforce that's, dealing with incredible demand, really tough turnover rates, and more complex rules.
Yeah, the complexity.
Exactly. And our sources, they're basically saying the old way of thinking about human resources, it just doesn't work anymore. It needs a complete overhaul.
I really like that framing. It's not HR as like a pile of paperwork. It's shifting it completely, making it an enabler of people and their goals, as they put it.
That's it. So
Yeah.
HR stops being just, a back office function. Suddenly it's right at the heart of keeping good staff and making sure the care quality is high, which is tough in a sector that's, well, very compassionate, but also often very fragmented.
Okay, so our mission today then, what are we diving into?
Our mission today is really to unpack how technology fits into this, how it's being used or could be used to tackle these big structural problems in elderly care HR. We want to cut through some of the hype and see how providers can actually build workforces that are more resilient, more connected, using tools made for these really high stress, often non-desk jobs.
And the urgency for all this, it really comes down to the demographics, doesn't it? That paints the picture pretty clearly. The stakes are just incredibly high.
Well, absolutely. It's like a global wave hitting everywhere, but the speed is what's kind of shocking. Globally, the UN figures show by 2050, 1 out of every 6 people will be 60 or older. Back in 2019, it was only 1 in 11. So not slow change. It's accelerating fast.
And then you look at the US specifically, we're heading for a real tipping point, aren't we? Where the demand is just going to massively outstrip the supply of care. By 2034, I think the projection is 77 million adults age 65 plus. So yeah, for the first time ever, more seniors than kids.
Right. And if that's the demand side, think about the supply side, the actual caregivers. There was a 2024 report, Argentum, I think, estimating the senior living sector needs to fill, get this, over 3 million new jobs by 2040.
3 million. Wow, just to keep up. But right now, the situation feels more fragile than stable, doesn't it?
Fragile is a good word. You hear about annual turnover rates in long-term care being, well, alarmingly high is the phrase often used, usually somewhere between 40 and 55%. And that NCIAD report from 2024 showed average full-time staff vacancy rates around 8.4%. But we know for some direct care roles in certain areas, it's way higher, nearly double sometimes.
Yeah, I've seen those numbers. It's tough.
Imagine running anything when potentially half your team leaves every year. Every single day must feel like putting out fires.
That kind of constant churn, it's not just inefficient, it must be really demoralizing for the staff who actually stick around.
Completely. And that brings us to this key idea from the sources, workforce resilience. Now, we're not just talking about people being tough. It's more about strategic setup, infrastructure.
Okay, so resilience as infrastructure, what does that look like?
It means the ability of a care team, let's think of, say, Maria, a dedicated new caregiver, to adapt and keep delivering good care consistently, even when there are staff shortages or, new regulations pop up. And just as importantly, it's about the HR team's ability to actually see problems coming and, well, prevent them before they blow up. So Maria's job doesn't just fall apart under the pressure.
I think that's maybe the core insight here, isn't it? The goal is to cut down all that admin hassle. So Maria, our caregiver, can actually focus on the human part, the compassion, the connection, the care itself. Every bit of unnecessary paperwork just gets in the way of that.
Absolutely. If you accept that, then HR tech needs to be about clarity and speed. So where did that transformation start? Well, it often starts tackling the biggest, earliest hurdle, that very first day on the job.
Right, simplified onboarding. We always hear retention starts day one. But how does smoother HR tech actually make Maria feel, more valued right off the bat?
It's not just about saving HR time, though it does that. It's about sending a message to Maria immediately. When she gets hired, that full interaction should feel slick, easy, maybe even on her phone. Think automated workflows, digital forms she can fill out quickly, maybe a welcome message, checklists tailored to her role.
Okay, so it feels professional, respectful of her time.
Exactly. It says, we value you. We're organized. We're ready for you. The sources claim automated onboarding can be like 3 times faster and cut the total onboarding time by around 60%.
60% faster. that gets Maria actually doing the job she was hired for much quicker, feeling ready. That has to help with keeping people, especially compared to drowning in forms for days.
Huge difference. And that speed, that efficiency, it flows right into the next critical area,
Right.
handling credentials and compliance smoothly.
Compliance. Yeah, this feels less like an annoyance and more like a serious risk area now.
It absolutely is. The regulatory scrutiny, it's definitely ramped up since around 2023. We know that missing a license renewal or letting required training lapse, it's not just a small oops anymore. It can lead to pretty hefty fines, bad audit results, things that can genuinely hurt a facility's finances.
Can you give a sense of that? Like, what's the real financial hit if there's a major slip up with credentials in today's audit climate?
Well, the sources point out it's often not just a one-time fine. It can actually jeopardize eligibility for state and federal funding. We could be talking millions, potentially. Plus the damage to reputation, which is hard to quantify, but very real.
Okay, so the stakes are incredibly high.
Which is why the solution is moving compliance away from, HR frantically chasing Maria for her updated CPR card. Instead, it becomes this proactive, centralized system. The technology tracks everything, alerts HR and Maria's supervisor before things expire, and pushes people to complete mandatory training. It builds that digital paper trail automatically.
So the system kind of manages the risk proactively, which frees up HR. They stop being the compliance police and can maybe be more strategic.
Exactly. And that freed up time, that mental energy, can then shift to something that really tackles that huge 40–55% turnover number.
Yeah.
Actual employee engagement.
Right. This feels like the aha moment the sources kept coming back to. Turnover isn't only about the pay rate, it's really fundamental about feeling, what was the phrase, seen, heard, and valued, especially in such a demanding job.
That's the core of it, feeling visible, feeling appreciated.
Okay, but let's push on that a bit. Can we be a little cynical? We're talking about jobs that are often lower wage, definitely high stress. Burnout is a massive issue. Can, like, an internal social platform with shout-outs really make up for tough schedules or pay that might feel too low?
Ugh. That's the critical question, isn't it? And the data, interestingly, suggests, yes, it can make a significant difference. Because it's not just fluff. Think of it as investing in cultural infrastructure. These platforms, like Workmates mentioned in the sources, they create a space for recognition, for teamwork to be seen.
So, peer-to-peer shout-outs, celebrating small wins.
Exactly.
Yeah.
And it encourages managers to give that positive feedback visibly, publicly. What's really striking is the metric they found. Active recognition drives engagement 12 times higher.
12 times, okay. That's not trivial.
It suggests that maybe we've underestimated how much feeling invisible contributes to people leaving. It wasn't just the money or the hours, it was feeling like a cog in the machine.
So breaking that invisibility cycle.
Addressing that transactional feel. But then the next hurdle is, okay, how do you reach everyone? Senior care runs 24/7. You've got night shifts, weekend crews. Maria on the night shift, for instance, she might never log into a desktop computer. She can easily miss out on email announcements or typical recognition efforts.
Yeah, that's a huge practical challenge. Connecting with those frontline staff, often mobile within the facility, who feel disconnected from the main office buzz.
And the sources highlight specific tools designed for this. Integrations like Redeep, for example. The idea is to leverage the tool everyone already has and uses their smartphone. Turn that into the secure hub for communication.
For non-desk staff specifically.
Right. So important updates, those recognition moments, even urgent compliance reminders. They reach Maria instantly, securely, on her phone, no matter her shift.
That instant reach feels essential in this sector. You can't wait for someone to check an email tomorrow. The sources also mention tools for crisis communication, right? Broadcasting urgent info and tracking who saw it.
Absolutely crucial. If there's an emergency or even just a sudden critical policy change, you can't just send an email and hope. You need to be able to instantly push that message to every single person on duty, maybe even those off-site, and ideally track that they've actually seen and acknowledged it. For safety, for liability, for just operational sanity.
Okay, so we've got smoother onboarding, proactive compliance, better engagement and communication reaching everyone. If we pull back again, there's one more big piece to this tech transformation, isn't there? Moving HR from just looking backwards.
To actually looking forwards, being predictive.
Yeah.
Data is really the foundation for that resilience we talked about. HR leaders need tools that don't just report last quarter's turnover number.
They need to see the patterns, right?
Exactly. Dashboards that visualize turnover trends, maybe by shift or department, or show upcoming gaps in required training or bottlenecks and how long onboarding is really taking. This gives leaders the insights to spot problems before they become full-blown crises. It's like seeing the hairline fracture before the whole thing cracks.
Okay, but moving from just running reports to actually, say, predicting which specific employees might be at high risk of leaving, that sounds pretty sophisticated. How feasible is that for, like, an average senior living community?
It's becoming more feasible because the technology is being built for this sector. It works by pulling together data points that are usually already in the HR system. Things like how often someone requests shift changes, maybe how long it's been since they received any formal recognition, or if their certification is coming up for renewal soon.
So it's using existing data to flag leading indicators.
Precisely. The software does the heavy lifting of spotting these patterns automatically. It doesn't need a dedicated data science team on staff. He just needs to raise a flag, allowing a manager to maybe check in, offer some coaching, or give some timely recognition before Maria starts polishing her resume.
Right, intervention before resignation. Makes sense. Okay, so this whole system overhauled, it sounds like a lot, but when you boil it down, the strategic priorities for leaders heading towards, say, 2026 seem pretty focused. Let's maybe synthesize those key takeaways for organizations wanting to build that resilience.
Yeah, there are three main priorities that really stand out from the sources. Priority one, automate the burden, not the connection.
Okay, what does that mean practically? Automate the annoying stuff, compliance tracking, onboarding paperwork, checklists, so managers have more time for the human stuff.
That's exactly it. Free up managers to actually mentor, coach, give meaningful face-to-face recognition. If your fancy new system makes it easier to track a form than it is to give someone a genuine great job, you've probably automated the wrong things.
Right. Focus automation on friction, not interaction.
Okay.
Priority two.
Priority two, invest in engagement as infrastructure. This really needs to shift from being seen as some, nice-to-have HR buzzword at the end of a strategy doc. Engagement, meaning the recognition, the feedback channels, the transparent mobile communication. It has to be treated as core retention infrastructure, just as critical as, say, the electronic health record system.
Treat it like essential plumbing, not just decoration. Got it. And the third priority.
And finally, priority three, leverage data to act early. HR leaders have got to use their analytics tools to anticipate problems, not just report on them after the fact. You need that visibility into the leading signs of turnover or compliance gaps so you can step in and support people like Maria before she feels she has no choice but to leave. It's proactive support, not, conducting exit interviews.
Proactive, not reactive. Okay. So, tying this all together, what's the big picture for the future of care? The main takeaway seems to be that this technology isn't about replacing the human element of care that's always the core, but it's about making that vital, compassionate work sustainable by stripping away a lot of the administrative and compliance stress that's just burning people out right now.
Precisely. You've got this historic demand for care because of the aging population. The future of whether we can actually meet that demand with quality care. It hinges entirely on whether we can figure out how to empower and, crucially, keep the very people providing that care. They are arguably one of the most stressed workforces in the economy right now.
So it all comes back to supporting the caregiver.
It does. And maybe that raises a final thought for your listener. Think about your own work, your own industry. Where is that administrative burden, that friction point? What's the thing that, if you could automate it or streamline it, would free up your team to really focus on the core human mission of whatever it is you do, whether that's connection, creativity, or care itself? Where's your friction point?